Today, we're diving into one of the most versatile and powerful ingredients you can find in your kitchen, garlic. Did you know that, besides adding incredible flavor to your dishes, garlic can also offer a range of health benefits? But that's not all. In today's video, we'll delve deep and uncover everything about garlic, from its amazing health benefits and potential contraindications to the various ways to use it for maximum positive effects. And to make things even more interesting, we'll look at some scientific research revealing garlic's real impact on health. Get ready for a fascinating journey into the world of garlic, and stay tuned to discover how this small ingredient can have a big impact on your life. Don't miss out. Let's get started. 1. Boosting the immune system. The immune system is the body's natural defense against infections, diseases, and external invaders like viruses, bacteria, and fungi. Garlic is known for its immunomodulatory properties, meaning it can both stimulate and regulate the immune system to ensure it functions effectively. Active compounds. Garlic contains sulfur compounds like allicin, which is released when garlic is crushed or chopped. Allicin is particularly effective in combating pathogenic microorganisms. Additionally, garlic is rich in vitamin C, which is essential for the proper functioning of immune cells. Antimicrobial action. Garlic has historically been used to prevent and treat infections. Allicin, along with other compounds such as agene and polysaccharides, combats a wide range of pathogens, including bacteria like Escherichia coli and Staphylococcus aureus, viruses like the flu virus, and fungi like Candida albicans. Antioxidant effect. Garlic also helps protect the body against oxidative stress, which can weaken the immune system. The antioxidants in garlic neutralize free radicals, which are unstable molecules that can damage immune cells and impair their functions. Immune response modulation. Garlic can enhance the activity of natural killer (NK) cells and macrophages, which are types of immune cells responsible for destroying infected cells and pathogens. Additionally, garlic may help regulate the inflammatory response, ensuring that the immune system does not attack the body itself, which could lead to autoimmune diseases. 2. Reducing blood pressure. High blood pressure, or hypertension, is a major risk factor for cardiovascular diseases, including myocardial infarction and stroke. Garlic has been extensively studied for its potential to help reduce blood pressure. Allicin and vasodilation. Allicin, released when garlic is crushed, has a potent vasodilatory effect. It promotes the relaxation of smooth muscles lining the blood vessels, causing them to dilate, increase in diameter. This reduces resistance to blood flow, thereby lowering blood pressure. Inhibition of angiotensin-converting enzyme, ACE. Garlic acts similarly to antihypertensive medications by inhibiting ACE, an enzyme that promotes the constriction of blood vessels and increases blood pressure. By blocking this enzyme, garlic helps keep blood vessels dilated and blood pressure under control. Increased production of nitric oxide. Garlic also stimulates the production of nitric oxide, a molecule crucial for regulating blood pressure. Nitric oxide relaxes the walls of blood vessels, promoting vasodilation and improving blood flow. Reduction of oxidative stress. Hypertension is associated with increased oxidative stress in the body. Garlic, with its potent antioxidants, combats free radicals that damage blood vessel walls, helping to prevent hypertension and its complications. 3. Improving cardiovascular health. Cardiovascular diseases are the leading cause of death worldwide, and diet plays a crucial role in their prevention. Garlic offers several benefits that contribute to heart and blood vessel health. Reduction of LDL cholesterol. Garlic has the ability to reduce levels of LDL cholesterol, known as bad cholesterol. LDL can deposit on the walls of arteries, forming plaques that narrow and harden the arteries, a process called atherosclerosis. By lowering LDL, garlic helps prevent plaque buildup and keeps arteries clear. Increase in HDL cholesterol. Garlic may also increase levels of HDL cholesterol, known as good cholesterol. HDL carries cholesterol from the arteries back to the liver, where it is metabolized and eliminated from the body. Higher HDL levels are associated with a lower risk of heart disease. Prevention of atherosclerosis. In addition to influencing cholesterol levels, garlic also reduces LDL oxidation, a process contributing to atherosclerotic plaque formation. Garlic's antioxidant compounds protect LDL from oxidation, helping to prevent atherosclerosis. Reduction of platelet aggregation. Garlic has an anticoagulant effect, similar to aspirin, which helps reduce the aggregation of platelets in the blood. This is important because clot formation can block arteries and cause a heart attack or stroke. Garlic helps keep the blood fluid, reducing the risk of thrombosis. 4. Antioxidant properties. Antioxidants are essential for protecting cells from damage caused by free radicals. These radicals are unstable molecules that can damage DNA, proteins, and other cellular structures, contributing to aging and chronic diseases. Antioxidant compounds. Garlic contains several compounds with potent antioxidant properties, such as allicin, flavonoids, and selenium. These compounds help neutralize free radicals, preventing cellular damage. Protection against cellular aging. Oxidative stress is closely linked to the aging process, as free radicals can cause cumulative damage to cells over time. Garlic's antioxidants help slow this process, protecting cells from premature aging and maintaining cellular integrity. Prevention of chronic diseases. Oxidative stress is a contributing factor to various chronic diseases, such as cancer, type 2 diabetes, and heart disease. By combating free radicals, garlic's antioxidants help reduce the risk of these conditions, promoting better long-term health. Maintenance of skin health. In addition to protecting the body internally, garlic's antioxidants also benefit the skin. They help combat signs of aging, such as wrinkles and spots, keeping the skin younger and healthier. 5. Anti-inflammatory effect. Inflammation is a natural response of the body to injury and infection, but chronic inflammation can lead to various diseases, including arthritis, heart disease, and diabetes. Garlic is known for its anti-inflammatory properties, which can help reduce inflammation in the body. Inhibition of inflammatory enzymes. Garlic contains compounds like allicin and agene that inhibit the activity of pro-inflammatory enzymes, such as cyclooxygenase, COX, and lipoxygenase, LOX. These enzymes are involved in the production of prostaglandins and leukotrienes, which are mediators of inflammation. By inhibiting these enzymes, garlic helps reduce the production of inflammatory substances. Reduction of inflammatory cytokines. Cytokines are signaling molecules that regulate the inflammatory response in the body. Garlic has the ability to reduce the expression of pro-inflammatory cytokines, such as TNF-alpha and interleukin-6, IL-6, which are involved in promoting chronic inflammation. Benefits for arthritis and other inflammatory diseases. Garlic can be particularly beneficial for people with arthritis, a condition characterized by inflammation in the joints. By reducing inflammation, garlic can help alleviate pain and stiffness in the joints. Additionally, its anti-inflammatory properties may benefit other inflammatory conditions, such as inflammatory bowel disease, IBD, and asthma. Protection against chronic diseases. Chronic inflammation is associated with the development of several chronic diseases, such as heart disease, type 2 diabetes, and cancer. By reducing inflammation in the body, garlic helps protect against these conditions, promoting better long-term health. 6. Antimicrobial action. The antimicrobial action of garlic is one of the reasons it has been used for millennia in traditional medicine to treat and prevent infections. Garlic is effective against a wide range of microorganisms, including bacteria, viruses, fungi, and parasites. Combating bacteria. Allicin, the main active compound in garlic, has potent antibacterial activity. It destabilizes bacterial cell membranes, causing their death. Garlic is effective against various bacterial strains, including antibiotic-resistant ones, such as methicillin-resistant Staphylococcus aureus, MRSA. Effectiveness against viruses. Garlic also has antiviral properties, making it useful in preventing and treating viral infections like the flu, the common cold, and even herpes simplex virus. Allicin and other sulfur compounds in garlic inhibit viral replication and strengthen the body's immune response against viruses. Fighting fungi. Garlic is effective against various species of fungi, including Candida albicans, which can cause infections in different body parts, such as the mouth, gastrointestinal tract, and genital tract. Garlic can be used both topically and internally to treat fungal infections. Action against parasites. Garlic has traditionally been used to combat parasitic infections, such as giardiasis and amoebiasis. Garlic compounds paralyze and kill parasites, while also strengthening the immune system to fight infestations. 7. Digestive support. Garlic has a beneficial effect on the digestive system, helping to improve digestion and prevent gastrointestinal problems. Stimulating digestive enzyme production. Garlic stimulates the production of digestive enzymes in the stomach and pancreas, aiding in the breakdown of food and nutrient absorption. Efficient digestion is essential for overall health, as it ensures the body receives the nutrients needed to function properly. Preventing digestive disorders. Garlic can help prevent and relieve digestive disorders like indigestion, bloating, and flatulence. Its anti-inflammatory and antimicrobial compounds combat harmful bacteria and fungi in the gastrointestinal tract that can cause these issues. Prebiotic effect. Garlic contains prebiotic fibers, such as inulin, which serve as food for beneficial bacteria in the gut. These bacteria play a crucial role in digestion, nutrient absorption, and maintaining gut health. Regular garlic consumption can help maintain gut microbiota balance, promoting digestive health. Relief from gastritis and ulcers. Garlic can help alleviate symptoms of gastritis and gastric ulcers caused by Helicobacter pylori bacteria. Its antimicrobial compounds inhibit the growth of this bacteria, while its anti-inflammatory properties help reduce inflammation in the stomach lining. 8. Weight control support. Garlic may play a role in weight control by helping to reduce body fat and improve metabolism. Thermogenic effect. Garlic may increase thermogenesis, which is the production of heat in the body. This leads to an increased metabolic rate, meaning the body burns more calories, even at rest. This effect can help with weight loss and maintaining a healthy weight. Appetite regulation. Garlic may help regulate appetite by reducing food cravings and increasing feelings of fullness. It contains compounds that affect hormones involved in appetite control, such as leptin, which signals to the brain when the body is full. Reduction of fat formation. Garlic can inhibit the formation of new fat cells, adipocytes, in the body, a process known as adipogenesis. This is particularly important for preventing weight gain, especially in people prone to accumulating body fat. Improving insulin sensitivity. Garlic may improve insulin sensitivity, which is crucial for weight control and preventing type 2 diabetes. Insulin is a hormone that regulates blood sugar levels and fat storage. When body cells are more sensitive to insulin, they use glucose more efficiently, reducing fat accumulation. 9. Cancer protection. Garlic has been extensively studied for its potential in cancer prevention. Its bioactive compounds have shown promising effects in inhibiting the growth of cancer cells and reducing the risk of various types of cancer. Inhibition of cellular proliferation. Garlic can inhibit the proliferation of cancer cells, preventing them from multiplying and forming tumors. Compounds like allicin, diallyl sulfide, and a gene have demonstrated the ability to induce apoptosis, programmed cell death, in cancer cells without affecting healthy cells. Prevention of free radical formation. Garlic is rich in antioxidants that help neutralize free radicals. These free radicals can damage cellular DNA, leading to mutations and eventually cancer. By protecting cells from these damages, garlic helps prevent carcinogenesis, cancer formation. Modulation of detoxifying enzymes. Garlic may enhance the activity of detoxifying enzymes in the liver, such as glutathione S-transferase, which helps eliminate carcinogens from the body. This reduces the burden of carcinogens in the body and decreases cancer risk. Reduction of angiogenesis. Angiogenesis is the process of forming new blood vessels, which is essential for tumor growth and spread. Garlic may inhibit angiogenesis in tumors, hindering their growth and metastasis, spread to other parts of the body. 10. Bone health improvement. Bone health is crucial for preventing conditions like osteoporosis, especially in postmenopausal women and the elderly. Garlic may help improve bone health in several ways. Increasing calcium absorption. Garlic may enhance calcium absorption in the body, which is essential for the formation and maintenance of strong bones. Calcium is the most abundant mineral in bones, and its deficiency can lead to weak bones and fractures. Reducing bone loss. Garlic contains compounds that help reduce bone loss, a common issue with aging. Allicin and other compounds in garlic can inhibit the activity of osteoclasts, cells that break down bone tissue. This helps preserve bone density and prevent conditions like osteoporosis. Improving hormonal balance. Garlic may help regulate estrogen levels, a hormone that plays a crucial role in bone health, especially in women. After menopause, estrogen levels drop, increasing the risk of osteoporosis. Garlic can help mitigate this risk by maintaining more balanced hormonal levels. Reducing inflammation. Chronic inflammation can contribute to bone deterioration. Garlic's anti-inflammatory properties help reduce inflammation in the body, protecting bones from inflammatory damage and promoting long-term bone health. 11. Improved blood circulation. Good blood circulation is vital for overall health, as it ensures that all tissues and organs in the body receive adequate oxygen and nutrients. Garlic can improve blood circulation in several ways. Vasodilation. Garlic promotes vasodilation, which is the relaxation and widening of blood vessels. This improves blood flow and reduces pressure on the heart, helping to prevent conditions such as hypertension and heart disease. Reduction of blood viscosity. Garlic can reduce blood viscosity and thickness, which facilitates circulation and decreases the risk of blood clots. This is particularly important for preventing events such as thrombosis, heart attacks, and strokes. Improving endothelial health. The endothelium is the inner layer of blood vessels, and its health is crucial for proper blood circulation. Garlic may improve endothelial function, ensuring that blood vessels can expand and contract as needed to regulate blood flow. Preventing atherosclerosis. Garlic helps prevent atherosclerosis, which is the hardening and narrowing of arteries due to fat plaque buildup. This ensures that blood can flow freely through the arteries, reducing the risk of cardiovascular diseases. 12. Reduction of fatigue and increase in energy. Garlic is known for its role in boosting energy levels and combating fatigue, a quality that has been explored since ancient times, especially among athletes and laborers. Increased cellular energy production. Garlic contains compounds such as allicin, which can increase cellular energy production, especially in the mitochondria, which are the powerhouses of the cells. This means that garlic helps cells produce more ATP, adenosine triphosphate, the body's main energy currency, thus improving energy levels. Improved blood circulation and tissue oxygenation. By promoting vasodilation and improving blood circulation, garlic ensures that muscles and other tissues receive more oxygen and nutrients during physical activities. This helps reduce the sensation of fatigue and improves physical performance, both in exercise and daily tasks. Reduction of oxidative stress. Garlic has potent antioxidant properties that help neutralize free radicals, which are responsible for oxidative stress in cells. Oxidative stress is one of the main causes of chronic fatigue, as it damages cells and impairs energy production. By combating these free radicals, garlic contributes to more consistent and lasting energy levels. Regulation of stress hormones. Garlic can influence the production of stress-related hormones such as cortisol. Elevated cortisol levels are associated with fatigue and mental exhaustion. Garlic helps balance these hormones, promoting a sense of well-being and energy. 13. Improvement of mental and cognitive health. Garlic has shown significant benefits for mental health and cognitive function, offering protection against neurodegenerative diseases and promoting mental clarity. Protection against neurodegenerative diseases. Garlic contains antioxidants that protect brain cells from damage caused by free radicals. This is crucial in preventing neurodegenerative diseases such as Alzheimer's and Parkinson's, which are associated with the accumulation of oxidative damage in the brain. Improvement of cerebral circulation. Garlic helps improve blood flow to the brain, ensuring that the brain receives enough oxygen and nutrients to function properly. Good cerebral circulation is essential for maintaining cognitive functions such as memory, concentration, and reasoning. Reduction of brain inflammation. Chronic inflammation in the brain is a risk factor for several neurological diseases. Garlic has anti-inflammatory properties that help reduce brain inflammation, protecting nerve cells and promoting the health of the central nervous system. Support for mood and reduction of anxiety. Garlic can also influence mood and anxiety levels, possibly through the regulation of neurotransmitters in the brain. It may help increase levels of serotonin, a neurotransmitter associated with well-being and happiness, thereby helping to combat symptoms of depression and anxiety. 14. Detoxifying action. Garlic has detoxifying properties, helping the body eliminate toxins and harmful substances. Stimulation of detoxifying enzymes. Garlic contains sulfur compounds that activate liver enzymes responsible for detoxification. These enzymes, such as glutathione transferase, help neutralize and eliminate toxins from the body, preventing their accumulation and protecting against cellular damage. Protection against heavy metals. Garlic is particularly effective in detoxifying heavy metals such as lead, mercury, and cadmium. It helps bind these metals and facilitates their excretion from the body. Allicin and other sulfur compounds in garlic are responsible for this chelating ability, which protects organs like the kidneys and liver from damage caused by heavy metals. Support for the lymphatic system. The lymphatic system plays a crucial role in removing toxins from the body. Garlic can support the lymphatic system by improving lymphatic circulation and strengthening the immune system, facilitating the efficient removal of waste and toxins. Reduction of fat accumulation in the liver. Garlic also helps prevent the accumulation of fat in the liver, a condition known as fatty liver disease, which can impair the liver's ability to detoxify the body. By promoting liver health, garlic ensures that the liver can perform its detoxification functions efficiently. 15. Support for respiratory health. Garlic has traditionally been used to treat and prevent a variety of respiratory conditions due to its anti-inflammatory, antimicrobial, and expectorant properties. Prevention and treatment of colds and flu. Garlic is widely recognized for its ability to prevent and treat colds and flu. Its sulfur compounds, such as allicin, have antiviral and antibacterial properties that help fight the pathogens responsible for these infections. Additionally, garlic can stimulate the immune system, making it more effective in responding to respiratory infections. Relief of nasal congestion. Garlic has expectorant properties, helping to loosen mucus in the lungs and respiratory passages. This facilitates expectoration and relieves nasal congestion, making it easier to breathe and speeding recovery from colds and other respiratory infections. Treatment of bronchitis and other lung diseases. Garlic may be useful in the treatment of bronchitis, asthma, and other inflammatory lung conditions. Its anti-inflammatory properties help reduce airway inflammation, while its antimicrobial properties combat secondary infections that can worsen these conditions. Protection against chronic respiratory diseases. Regular consumption of garlic may offer long-term protection against chronic respiratory diseases, such as chronic obstructive pulmonary disease, COPD. By reducing inflammation, combating infections, and supporting lung function, garlic contributes to overall respiratory health. These 15 benefits of garlic highlight its incredible potential to improve health comprehensively, offering support for the heart, immune system, brain, digestion, and more. Incorporating garlic into your diet can be a simple and effective strategy to promote well-being and prevent a variety of diseases. 1. Gastrointestinal issues. Garlic can be difficult to digest for some people, especially when consumed raw or in large quantities. This is because garlic contains sulfur compounds, such as allicin, which are highly reactive and can irritate the lining of the stomach and intestines. Heartburn and reflux. Garlic can relax the lower esophageal sphincter, the valve that separates the stomach from the esophagus, allowing stomach acid to rise into the esophagus, causing heartburn and acid reflux. This effect is more pronounced in people with gastroesophageal reflux disease, GERD. Nausea and vomiting. Irritation of the gastrointestinal tract can cause nausea and, in more severe cases, vomiting. This effect may be exacerbated in people with a history of gastric disorders. Gas and abdominal bloating. Garlic can increase gas production in the gastrointestinal tract, resulting in abdominal discomfort, bloating, and flatulence. This is because garlic contains complex carbohydrates, which can be fermented by bacteria in the large intestine, producing gas. Diarrhea. In some people, excessive consumption of garlic can speed up intestinal transit, resulting in loose stools or diarrhea. This effect is more common in people with conditions such as irritable bowel syndrome, IBS, who are already more sensitive to certain foods. 2. Interactions with anticoagulant medications. Garlic has anticoagulant properties due to the presence of compounds such as allicin, which can inhibit platelet aggregation, an essential process for blood clotting. Increased risk of bleeding. For people already taking anticoagulants, such as warfarin, heparin, or aspirin, garlic can increase the risk of excessive bleeding. This is especially dangerous during surgeries, dental extractions, or any situation where bleeding control is critical. Potentiation of medication effects. Garlic can enhance the potency of anticoagulant medications, leading to an excessive reduction in blood clotting. This can result in internal bleeding, frequent bruising, or prolonged bleeding after minor cuts. 3. As surgeries and medical procedures. Due to its anticoagulant properties, garlic can pose an additional risk during and after surgeries or invasive procedures. Excessive bleeding during surgery. During surgery, bleeding control is crucial. Garlic can make this process more difficult, increasing the risk of intraoperative complications, such as excessive bleeding that can be difficult to control. Risk of postoperative complications. Garlic can prolong clotting time after surgery, which means that the healing process may be slower, and the risk of postoperative bleeding may be higher. This can complicate recovery and require additional medical attention. Medical recommendations. It is generally recommended that garlic consumption be discontinued at least 1 to 2 weeks before surgery or dental procedures. This allows the body to restore normal blood clotting levels and minimizes the risk of excessive bleeding. For allergies. Although garlic allergies are rare, they can occur and manifest in various forms, ranging from mild skin reactions to severe anaphylactic reactions. Skin rashes and hives. Allergic reactions to garlic can manifest as skin rashes, hives, or contact dermatitis. This can occur from both consuming garlic and direct contact with raw garlic. These rashes can cause intense itching and discomfort. Respiratory difficulties. In more severe cases, consuming garlic can cause respiratory symptoms, such as wheezing, shortness of breath, coughing, or chest tightness. These reactions can be dangerous and require immediate medical attention. Anaphylaxis. In rare cases, a garlic allergy can lead to anaphylaxis, a severe allergic reaction that can be life-threatening. Symptoms include swelling of the throat and tongue, difficulty breathing, a rapid drop in blood pressure, and loss of consciousness. Anaphylaxis is a medical emergency that requires immediate treatment with epinephrine and hospital care. 5. Low blood pressure, hypotension. Garlic is known for its ability to lower blood pressure, which can be beneficial for people with hypertension but dangerous for those with hypotension, low blood pressure. Excessive drop in blood pressure. In people with already low blood pressure, consuming garlic can further lower their pressure, leading to symptoms of hypotension, such as dizziness, fainting, blurred vision, weakness, and fatigue. In extreme cases, blood pressure can drop to dangerously low levels, which can be fatal. Interactions with antihypertensive medications. For people taking medications to lower their blood pressure, garlic can potentiate the effects of these medications, increasing the risk of hypotension. This may require medication adjustments or a reduction in garlic intake. Blood pressure monitoring. People with low blood pressure or those taking antihypertensive medications should regularly monitor their blood pressure when consuming garlic and discuss any significant changes in symptoms with their doctor. 6. Bleeding disorders. Garlic can interfere with blood clotting, which can be problematic for people with bleeding disorders. Worsening of bleeding disorders. People with conditions like hemophilia, thrombocytopenia, or other disorders that affect blood clotting should avoid excessive garlic consumption. Garlic can inhibit platelet aggregation, essential for clotting, increasing the risk of uncontrolled bleeding and hemorrhagic complications. Risk of internal bleeding. In people with bleeding disorders, garlic can increase the risk of internal bleeding, which can be difficult to detect and treat. This includes bleeding in the gastrointestinal tract, brain, or other vital organs. Special precautions. It is important for people with bleeding disorders to consult a hematologist or doctor before including garlic in their diet, especially in therapeutic doses. 7. Thyroid problems. Garlic contains iodine and can influence thyroid function, especially in people with pre-existing conditions. Influence on thyroid metabolism. Garlic can affect iodine metabolism in the body, which is essential for the production of thyroid hormones. In people with hypothyroidism, insufficient production of thyroid hormones, or hyperthyroidism, excessive production of thyroid hormones, garlic can interfere with thyroid function and worsen symptoms. Potential to trigger thyroid disorders. In predisposed individuals, excessive garlic consumption may contribute to the development of thyroid disorders, especially in areas with iodine deficiency. Monitoring and medical consultations. People with thyroid problems should regularly monitor their thyroid function and discuss garlic use with an endocrinologist to ensure there is no interference with treatment or worsening of the condition. 8. Interaction with antiretroviral medications. Garlic may negatively interact with medications used in the treatment of viral infections, particularly antiretrovirals used in the treatment of HIV. Reduction of medication efficacy. Some studies suggest that garlic may induce enzymes in the liver that metabolize antiretroviral medications, such as sequinavir, reducing their concentration in the blood and thus their efficacy. This can compromise treatment and increase the risk of disease progression. Risk of viral resistance. Underdosing of antiretrovirals due to interaction with garlic can lead to the development of viral resistance, making the virus more difficult to treat and increasing the risk of therapeutic failure. 9. Pregnancy and breastfeeding. While garlic is safe in normal dietary amounts, its consumption in large quantities or as a supplement during pregnancy and breastfeeding requires caution. Risk of bleeding during pregnancy. Since garlic has anticoagulant properties, excessive consumption during pregnancy may increase the risk of bleeding, especially during childbirth or in cases of placenta previa, where the risk of hemorrhage is already elevated. This effect can pose a danger to both the mother and the baby. Potential estrogenic effect. Some evidence suggests that garlic may have estrogenic effects, meaning it could influence estrogen levels in the body. This might interfere with hormonal balance during pregnancy, although the evidence is not conclusive. However, excessive consumption may not be recommended without medical guidance. Altered taste in breast milk. During breastfeeding, garlic can alter the taste of breast milk, which may lead to the baby refusing to nurse. Although not harmful to the baby, this can affect feeding and the nutritional development of the newborn. Recommended medical consultations. Pregnant or breastfeeding women should consult their doctors before consuming large amounts of garlic or garlic supplements to ensure that there are no associated risks to their health or the baby's health. 10. Interference with diagnostic tests. Garlic can influence the results of some diagnostic tests due to its anticoagulant properties and its impact on liver function. Alteration in coagulation tests. Since garlic can affect blood coagulation, it may interfere with the results of tests like prothrombin time, PT, and activated partial thromboplastin time, APTT, which measure the blood's ability to clot. This can result in abnormally prolonged readings, suggesting deficient coagulation. Impact on liver function tests. Garlic can induce liver enzymes involved in the metabolism of drugs and other compounds. This can alter the results of liver function tests, such as ALT and AST, leading to readings that might suggest liver injury or dysfunction when, in reality, it's a response to garlic. Pre-test precautions. It is advisable to inform your doctor about garlic consumption before undergoing diagnostic tests, especially if these tests involve coagulation or liver function. This allows the doctor to interpret the results more accurately and consider the potential influence of garlic. 11. Oral sensitivity. Garlic, especially in its raw form, can cause irritation and a burning sensation in the mouth, gums, and tongue in sensitive individuals. Allergic stomatitis. Some people may develop allergic stomatitis, a painful inflammation of the oral mucosa, after consuming garlic. This can result in swelling, redness, and ulcerations in the mouth. Chemical burn. Raw garlic contains highly reactive sulfur compounds that can cause an intense burning sensation in the mouth. In rare cases, this reaction can be strong enough to cause mild chemical burns in the oral mucosa. Dental discomfort. For people with sensitive gums or dental issues, raw garlic can exacerbate discomfort and pain, making chewing and eating difficult. Suggestions to reduce irritation. To avoid irritation, garlic can be cooked or roasted, which reduces the potency of the irritating compounds. Additionally, consuming garlic with other foods can help dilute its effect in the mouth. 12. Body odors. Regular consumption of garlic can cause strong body odors, which may be a social concern for some individuals. Strong breath. Allicin, the active compound in garlic, is metabolized in the body and released through the breath, resulting in a characteristic odor that can persist for hours after consumption. This effect can be uncomfortable and socially embarrassing. Body odors. Garlic can also be excreted through the skin, causing body odors that may be difficult to eliminate even with regular bathing. This is due to volatile sulfur compounds that are released through the pores. Tips to minimize odors. To reduce odors, some people consume parsley or chew cardamom seeds after eating garlic. Drinking milk can also help neutralize garlic odor on the breath. 13. Insulin resistance. Although garlic can help regulate blood sugar levels, it may interfere with glucose metabolism and insulin response in predisposed individuals. Hypoglycemic potential. For people who already have low insulin resistance or are hypoglycemic, excessive garlic consumption may further lower blood glucose levels, resulting in symptoms of hypoglycemia, such as dizziness, tremors, confusion, and even fainting. Interaction with anti-diabetic medications. Garlic can potentiate the effect of anti-diabetic medications, increasing the risk of hypoglycemia. This may require adjustments in medication dosage or a review of garlic consumption. Recommended monitoring. Diabetics and people with metabolic disorders should monitor their blood glucose levels when consuming garlic and adjust their diet or medication as necessary, under medical guidance. 14. Kidney problems. Garlic contains potassium, which in excess can be problematic for people with kidney failure. Potassium overload. For people with kidney problems, excess potassium in the diet can lead to hyperkalemia, a dangerous condition where blood potassium levels become too high. This can cause symptoms like muscle weakness, cardiac arrhythmias, and in severe cases, cardiac arrest. Monitoring potassium levels. People with kidney failure should carefully monitor their potassium intake, including the amount from garlic, and consult a nephrologist for specific dietary guidance. 15. Side effects in children. Garlic should be administered with caution in children, especially in its raw form. Digestive sensitivity. Children have more sensitive digestive systems, and raw garlic can cause stomach irritation, diarrhea, and abdominal discomfort. It is important to introduce garlic into a child's diet in small amounts and observe any adverse reactions. Risk of aspiration. Raw garlic is hard and can pose an aspiration risk for young children. It should be well crushed or cooked before being given to children to avoid this risk. Pediatric consultations. Before adding garlic in significant amounts to a child's diet, especially as a supplement, it is advisable to consult a pediatrician to ensure that it is safe and appropriate for the child's age and health. These contraindications emphasize the importance of consuming garlic in moderation and seeking medical advice when necessary, especially in cases of pre-existing health conditions or medication use. Various scientific studies have explored the health benefits of garlic, and many studies have confirmed its medicinal properties. Below are some notable studies highlighting the benefits of garlic. 1. Antioxidant and cardioprotective effects. Study: aged garlic extract reduces blood pressure in hypertensives and improves arterial stiffness. A randomized controlled trial, 2010. Description: this study, published in Maturitas, involved 79 hypertensive patients and investigated the effect of aged garlic extract on blood pressure. The results showed that aged garlic significantly reduced blood pressure compared to the placebo group and improved arterial stiffness. This suggests that garlic may be an effective cardioprotective agent, particularly for people with hypertension. Reference: Reed, K. et al., 2010. Aged garlic extract reduces blood pressure in hypertensives and improves arterial stiffness. A randomized controlled trial. Maturitas, 67, 144 to 150. DOA 10.1016/J Maturitas.2010.05.009. 2. Antimicrobial effects. Study: antimicrobial properties of allicin from garlic, 2012. Description: published in Microbes and Infection, this study examined the antimicrobial properties of garlic, focusing on the compound allicin. The researchers found that allicin exhibits broad antimicrobial activity against a variety of bacteria, including antibiotic-resistant strains. The study concluded that allicin could be an alternative or complement to conventional antibiotics in fighting bacterial infections. Reference: Borlinghouse, J. et al., 2014. Allicin, Chemistry and Biological Properties. Microbes and Infection, 16, 125 to 139. DOA 10.1016/J Demycin.2013.11.005. 3. Anti-cancer effects. Study: allium vegetables and risk of cancer. A review of the evidence, 2001. Description: a review study published in the American Journal of Clinical Nutrition analyzed the relationship between the consumption of allium vegetables, including garlic, and the risk of cancer. The review covered various epidemiological and experimental studies, concluding that regular garlic consumption is associated with a reduced risk of several types of cancer, including stomach, colon, and esophageal cancer. Suggested mechanisms include the induction of detoxification enzymes and inhibition of carcinogenic nitrosamine formation. Reference: Fleischhauer, A. T. et al., 2001. Allium vegetables and risk of cancer. A review of the evidence. American Journal of Clinical Nutrition, 73, 5, 1032 to 1040. DOA 10.1093/Edge/73.5.1032s. 4. Effects on metabolic health. Study: garlic supplementation improves inflammatory profiles and blood lipids in metabolic syndrome patients. A randomized, double-blind, placebo-controlled, crossover study, 2016. Description: this study, published in the Journal of Nutrition, evaluated the effects of garlic supplementation in patients with metabolic syndrome. The study involved 55 participants and demonstrated that garlic supplementation reduced inflammatory markers and improved lipid profiles, lowering LDL cholesterol and triglycerides while increasing HDL cholesterol. The results suggest that garlic may benefit metabolic and cardiovascular health in individuals with metabolic syndrome. Reference: Zaire, R. et al., 2016. Garlic supplementation improves inflammatory profiles and blood lipids in metabolic syndrome patients, a randomized, double-blind, placebo-controlled, crossover study. Journal of Nutrition, 146, 3, 427-433. DOA, 10.3945/JN.115.219675. 5. Anti-inflammatory properties. Study, Anti-inflammatory properties of aged garlic extract, involvement of immune modulation, 2007. Description: this study, published in the Journal of Nutrition, investigated the anti-inflammatory effects of aged garlic extract in human cells. The results indicated that aged garlic extract could modulate the immune system by reducing the production of inflammatory mediators such as pro-inflammatory cytokines. This suggests that aged garlic may be useful in managing chronic inflammatory diseases. Reference: El-Qayyim, A. et al., 2007. Anti-inflammatory properties of aged garlic extract, involvement of immune modulation. Journal of Nutrition, 137, 3 Supple 2, 977s, 980s. DOA, 10.1093/JN/137.3.977s. These studies show that garlic has a wide range of health benefits, from cardioprotective effects to anti-cancer and antimicrobial properties. However, it is important to remember that the results may vary depending on the form of garlic consumed and the dosage, and garlic consumption should be balanced within a healthy diet. Garlic can be used in various ways to take advantage of its health benefits. Below are some of the main ways to incorporate it into your diet and healthcare. 1. Raw garlic. Usage: raw garlic can be chopped, crushed, or grated and added to salads, sauces, and seasonings. Benefits: raw garlic contains allicin, a sulfur compound with antibiotic, anti-inflammatory, and antioxidant properties. Consuming it raw maximizes the concentration of allicin. Cautions: it can cause digestive irritation and bad breath. To reduce discomfort, start with small amounts and gradually increase. 2. Cooked garlic. Usage: garlic can be roasted, sautéed, or cooked. Roasting garlic results in a milder, sweeter flavor. Benefits: cooked garlic still contains several beneficial compounds, although at a lower concentration of allicin. Cooking can make garlic more palatable and less irritating to the digestive system. Cautions: even cooked, garlic can cause gastrointestinal discomfort if consumed in large quantities. 3. Garlic oil. Usage: garlic oil can be used to season food, in marinades, or as an ingredient in recipes. Benefits: garlic oil contains some of the beneficial compounds of garlic, such as allicin, but the concentration may be lower than in raw garlic. It can improve digestion and enhance the flavor of foods. Cautions: garlic oil should be stored properly to prevent rancidity. Excessive use can lead to digestive issues. 4. Garlic supplements. Usage: available in the form of capsules, tablets, or liquid extract. Benefits: supplements can provide a concentrated dose of allicin and other beneficial compounds, with less impact on breath and the digestive system. Cautions: it is important to follow dosage recommendations and consult a healthcare professional before starting any supplement, especially if you are taking other medications or have pre-existing health conditions. 5. Garlic powder. Usage: can be used as a powdered seasoning to flavor dishes like soups, meats, vegetables, and baked recipes. Benefits: makes it easy to add garlic to the diet without causing gastrointestinal discomfort. It is also convenient and has a longer shelf life than fresh garlic. Cautions: garlic powder may have fewer beneficial compounds compared to fresh garlic, and the quality may vary between brands. 6. Marinated garlic. Usage: garlic can be marinated in vinegar, olive oil, or other liquids. It is commonly used in pickles and as a condiment. Benefits: marinated garlic may have a milder, less pungent flavor. Marination can preserve some of garlic's beneficial properties, although allicin may be partially destroyed. Cautions: marinated garlic should be stored under proper conditions to prevent bacterial growth. Excess acid can alter the effectiveness of the beneficial compounds. 7. Garlic pastes and sauces. Usage: garlic can be incorporated into pastes, such as garlic paste, and sauces, like garlic sauce for pasta or meats. Benefits: makes it easier to consume garlic in recipes, and adds a pleasant flavor to dishes. The beneficial properties of garlic are preserved depending on the method of preparation. Cautions: the addition of other ingredients may influence the benefits of garlic. It is important to control the amount to avoid excesses and digestive problems. 8. Pickled garlic. Usage: garlic can be pickled, often in combination with vinegar or salt. Benefits: preserves garlic and allows its use in various recipes. Pickling can retain some of garlic's beneficial properties. Cautions: pickling must be done and stored properly to avoid contamination. Pickled garlic may have a high sodium content, which may not be ideal for everyone. 9. Fermented garlic. Usage: garlic can be fermented to create black garlic, which has a sweeter, more complex flavor. Benefits: fermented garlic may contain higher levels of antioxidants, and the fermentation process can increase the bioavailability of some beneficial compounds. Cautions: black garlic may have a higher price and a shorter shelf life, but is a tasty and nutritious alternative to fresh garlic. 10. Garlic in toothpaste. Usage: some natural toothpaste contains garlic extracts due to their antimicrobial properties. Benefits: may help fight bacteria in the mouth and improve oral health. Cautions: should be used as part of a regular oral care routine, not as a substitute for conventional dental treatment. Each form of garlic usage can offer distinct health benefits, and the most appropriate form will depend on individual preferences and needs. However, regardless of the chosen form, the key to enjoying the benefits of garlic is to consume it in moderation as part of a balanced and healthy diet. It is important to adjust garlic consumption as needed and consider any potential side effects, especially if there are pre-existing health conditions. Today, we've uncovered how this amazing ingredient can be a true ally for your health, offering benefits ranging from cardiovascular protection to antimicrobial and antioxidant properties. We also discussed possible contraindications and how to use it effectively, as well as explored some research that confirms its positive effects. Remember, like any food or supplement, garlic should be consumed in moderation and always as part of a balanced diet. If you're thinking of adding more garlic to your routine, why not start right now and try some of the ways we've shown here? Don't forget to like the video, subscribe to the channel, and hit the notification bell so you don't miss any updates. And, of course, share your own tips and experiences with garlic in the comments. Thank you for watching, and see you next time.